This time I'd like to call the June 26th Board of Health meeting to order. The first item before we approve the agenda is to have a vote and discussion on the board president or board vice president or president too. Nominations for vice president since Dr. Migliore resigned since our last meeting. So this time entertain motions for vice president.
I will nominate Betsy Lindman as vice president.
We have a motion. Do we have a second?
Second.
All right. Any other nominations do I need to ask for? What do I do now, Marcel? You usually do this.
Is there any discussion?
Any discussion on that nomination?
No discussion.
Seeing none, all in favor?
All in favor?
Aye.
Aye.
Opposed, same sign. Congratulations.
Congratulations. Thank you. Next item on the agenda is the adoption of the agenda. There is at least two versions of it, the agenda, but I think the agenda that the board has item 3, election of BOH vice president. So
Could I move to strike item 3, election of the BOH vice president?
otherwise,
Otherwise, everything is, everything the same.
we have a motion to approve the agenda in front of us with the removal of item 3, election of BOH vice president.
Second.
Thank you. Any further discussion on that, on the agenda? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda is the approval of the minutes. It is recommended to the Board of Health members to approve the minutes from the regular meeting of May 15th, 2024. Hopefully you've had a chance to review them and we'll entertain a discussion or a motion on the minutes as presented.
I'm sorry, I forgot to think about mentioning this earlier. In the minutes on page 5, they're talking about highlighting some of the changes, County Health Department budget. The third one, it says removed 1 EHS due to changes in legislature regarding property transfers. I guess I don't know how, my thought was, can we adjust that a bit to specify that it's an unfilled position, that we're not actually eliminating a position that somebody is currently in. I just thought maybe say removed 1 unfilled EHS position due to changes in legislature regarding property transfers, eliminating need for extra position. That's what I thought. Maybe it might be a way to do that. But I didn't want it to be, I wanted it to be unclear that we're not getting rid of a position that has a person in it. Anything?
Okay.
Oh, and then can I have one other thing? And then the 2 down, removed vector since it has funds available in HFI for 2025. Could we say like removed vector program funding, just to make it more clear?
Any other discussion or comments on the minutes? Somebody like to make a motion to approve the minutes subject to under 2024, third bullet, adding the word unfilled after removed 1 unfilled EHS, and under the 5th bullet, remove vector program funding since it has funds available in HFI for 2025.
I make a motion to approve the minutes as, with changes as discussed.
We have a motion. Do we have a second?
Second.
Any further discussion on the minutes? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item is board president announcements. I have no announcements other than to welcome Dr. Migliore into her new position. And, look forward to things to come. Next item on the agenda, health officer presentation and report.
Does anybody have any questions about any of the report If not, Mark Espic is going to update us a little bit on the new law that takes effect July 1st regarding property transfers.
Hello, House Bill 1329 recently passed, and it prohibits the Health Department from requiring property transfer inspections starting July 1st. So, well, it eliminates property transfer inspections within the outside the sole source aquifer area. So we are still requiring inspections, but it would only be required if the home has not transferred in the last 15 years or a new system was installed. So that, which means, you know, if the house transfers every 5 years for the next 100 years, they'll never be required to have a septic inspection. It has to go 15 years between transfers. The water testing requirement will remain in effect. So every property transfer in the county will either have to provide a water test or proof of the city utilities. And then that's, and then the other part of it is we can no longer charge a fee for the property transfer.
For water?
For water, for anything.
Any-
Yeah. In the past, they used to call it a water transfer fee. That wasn't our terminology. That was something the realtors threw out there. But it was a property transfer fee of $75.
So how are you gonna know if a property had been inspected within the last 15 years?
They'll have to provide proof of that inspection. We may have some of those records on hand. But they'll have to provide proof that it's been inspected.
So the seller will be responsible for that?
Well, yeah, we're still working with that. Tomorrow we have a meeting set up with the big three title companies. We're gonna just kind of an open discussion to kind of gather some information, and then from there we'll be putting together an FAQ page to kind of help out. We'll have our website updated with all this information, but it's gonna take some time to work through it all. You know, there's a EPA website that does show the sole source aquifer area. And so all you have to do is type in an address and it'll tell you whether it's within the boundary or not.
What do you mean within the
Within the boundary of the sole source aquifer. So if you're within that sole source aquifer boundary, you're required to do an inspection if it's transferred, or if it hasn't transferred in 15 years, or if a new system hasn't been installed within the past 15 years, you'll have to do that inspection. So the St. Joe Aquifer is the sole source aquifer. It's the only one here in the state. And it covers all of Granger, comes through downtown, kind of runs along Ardmore Trail and ends just west of the bypass out on the west side. But once you start getting out there, you get into the Kankakee Aquifer to the south. We have the Hilltop Aquifer, but there's about 9 different aquifers in the county, but the St. Joe Aquifer is the main one.
So none of the other aquifers those don't apply?
Right, because they're a sole source aquifer by definition is where more than 50% of the residents draw their drinking water from the aquifer. So the St. Joe Aquifer, and with Granger being as densely populated as it is, and all the wells we have up there, greater than 50% of the residents get their water from a private well. And so we're trying to protect that aquifer to make sure it doesn't become contaminated.
So the data center that is supposed to go in on Cleveland, how is that affected? Because they are directly in the aquifer.
Mhm.
How is that affected? How are
It
they?
shouldn't at all. My understanding, the data center will be using city water, and all the discharge will be going to the city POTW. Any questions?
So I guess just to be clear, so in an area like Granger, you are no longer allowed, you're no longer allowed to require a septic inspection for property transfer unless the person transferring the property has lived there for more than 15 years, or there hasn't been, or what is the other
A
category?
new system installed.
Or if there hasn't, okay, so they can live there for more than 15 years, but they installed a new system within 15 years, then you can't require.
Right, so it's not living there, it's a transfer. So if the property hasn't transferred for 15 years,
Mhm.
or if a new system was installed, or if it's just new construction. So
Okay,
if you build a house and sell it in 10 years, you do not have to have it inspected.
is the logic behind it that the buyer seller would want to have a septic inspection on their own, or?
To be honest, I don't really understand the logic behind it, but this is the new law that we have to deal with. And, and I think this law was specifically written against St. Joe County because we're the only ones that were requiring the property transfer inspection. So,
So,
we don't really, I don't agree with it. I think a lot of people will be hurt by it, but that's what we have to work with.
To answer your question, I mean, most buyers do inspections, but if you're buying a property as is and you're waiving inspections, now the septic and the water are no longer required to be done. Before, even if you waive inspections, the county said you still have to do septic and you have to do water.
okay.
Effective July 1st, that is no longer the case. So
Well,
when you're
wa-
waiving inspections, you're
The
waiving.
water will still have to be done, no matter where you are, whether you're in the sole source aquifer, anywhere within the county. Unless you're on city water, then you have to provide proof of the utilities.
Okay, so water will still be done, but we can't charge the fee.
Right.
Okay,
And so we're updating our form. So we'll still be notified when property transfers occur because they'll have to submit the property transfer application form along with the water test.
okay.
So we'll be able to track all future property transfers and, so we'll be okay tracking everything.
How, if you can't charge fees anymore, how will that affect the budget?
Quite a bit. We'll probably lose anywhere from 350 to 400,000 a year.
And if someone put in a new system, the reason they don't have to provide an inspection is because when the new system was put in, you are already inspecting that, correct?
Yeah, and we'll have record of when that system was installed. So a new system, 15 years if they go to sell it. Like I said, you can just continually transfer a property as long as it doesn't go 15 years between transfers, it'll never have to be inspected. Required. It can't, I mean, the homeowners hopefully, and talking with the realtors, a lot of them are still gonna, continue with it. It's really, some of the house flipping and that's where we expect problems.
I think the rationale behind the 15 years was we've had our transfer ordinance in place for 15 years. So I think part of the complaint from the legislator was, why do you keep inspecting these? You've already inspected them. So we don't agree with that, but that's the way the law got passed, so. And I personally feel somewhat fortunate we've got anything left after our initial meetings with them, so.
And when was your meeting with the title companies?
Tomorrow morning.
Thank you.
And if any real estate offices would like us to come in and, we can do that as well.
I like it.
Any other questions for Mark on the new?
Is there gonna be any communication to the general public on the website or otherwise for them to understand what that means? Meaning you are not required, but we recommend a inspection?
Well, we'll be putting out information, we'll be working with the title companies and realtors. Hopefully any
Hopefully. they know
buyers will have a
somebody.
realtor that will be able to relay that information.
All right, any other questions for Mark? Thank you, Mark. Any other questions for Dr. Migliori on the health officer's report?
Well, I was going to ask again with the environmental health section. You mentioned an educational outreach event with third and fourth graders at the Mishawaka Resin Biro Days. I was just curious to hear more about what that was about. And since Brett is coming up anyway, just a general overview on how mosquitoes are right now.
Not great. But for those of you who didn't see it in the news, Elkhart County reported a West Nile positive. They're one of the first 3 counties in the state to do so. We have begun our West Nile testing, trapping and testing. I have some interesting tests that I'm not looking forward to the results to tomorrow morning. But things are going well. The new vector program is really trucking. We're making lots of progress and doing lots of surveillance. We've done more tick surveillance in the past 2 months than we have probably in the last 5 years combined. Really looking forward to continuing that and identifying more areas where our ticks are, and if there are new ticks that we weren't aware of that are coming into the county, which I suspect there are. As for your question regarding the Mishawaka Res, that was a great time. We were there for 3 days. It was a number of schools within the Mishawaka school system sent their 3rd and 4th grade classes out. They had different stations were doing different things, walking through the woods, composting, recyclables, a variety of different things. But Josiah and myself were there talking about ticks and mosquitoes and how, make sure you pick up your toys in the yard, because if you leave them out, they could breed mosquitoes. Make sure that you wear your insect repellents. That way you don't get ticks on you and get sick, that sort of thing. The kids were really receptive to that. I showed them a variety of different mosquito traps, which they all found interesting because they're all different. Got to talk to them a bit about various different fun facts and creepy crawlies, but this is something that we started doing a couple of years ago, and the staff at the res really enjoyed having us out there and keep asking us to come back.
Can you tell more about exactly how you're doing tick surveillance?
Sure. So the primary way of doing tick surveillance is to drag a piece of canvas or corduroy along the edge of a trail, and especially corduroy, the texture is a lot like, deer or some sort of small mammal. And so we drag it for a little bit, and then you pick it up, and then you pluck them off with tweezers, essentially. We're also experimenting with some new types of traps that work on either CO2 or dry ice. There's one of the ticks that we're looking for that has been reported in the county in the past that may or may not be in the area. It is actually predaceous and does hunt for things that emit CO2. And so we're experimenting with some traps with that, trying to lure them in and then trap them on some carpet tape. Those types of traps have been really effective in other plains states, more so than the tick dragging. So,
Thank you.
Any other questions for Brent or Dr. Migliori? Going once? Do we do a motion? No, we don't do a motion to approve the health officer report, do we? We do. No discussion and vote, so. Can I get a motion to approve the health officer's report?
I will move to approve.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda, new business, item 2423, discussion and vote, job description, perinatal education and program coordinator. Sure.
Yeah, I was gonna say over there.
Oh, I'm sorry. Went right past that.
Slow down, John.
Sorry.
Unless you just don't want to do it, I.
Right, vital records.
Hello, I'm Erica, the Hidina Director of Vital Records. You guys all got the PowerPoint, I'm assuming. So we have had a change in staff. A few of our staff members are different. So I just wanted to give you a little bit of an introduction on who those people are. Paula is a current registrar in Mishawaka, but she is now cross-trained as a vital records registrar and immunization registrar. Katie, who was our vital records registrar, retired late April, and her position actually came over to the South Bend location, and that's why Paula is now cross-trained there in Mishawaka. She has only the all she does there for vital records is issuing birth and death records. We took some of the rest of the duties off of her, obviously, for the fact that she is doing two dual roles. Shannon is our current new registrar in South Bend. And then we have Lisa Murray, who started in September. So we have three essentially new registrars. And then there is Angelica Weatherspoon, who is our bilingual registrar, also in South Bend. Denise Kingsbury, our assistant director, and then myself. So that's a total of 5 now in South Bend. And for the record, we are very crowded in our office space, in case anybody needs to relay that to the powers that be. And a little bit of an overview, just simple facts. Records in St. Joe County started in 1882, but it didn't become a state law until 1907 to actually record records. We do serve 2 locations, obviously, one in Mishawaka and one in South Bend. The main reason why we did want to keep our Mishawaka location open is for convenience for people with small children, the elderly, people with disabilities, things like that, because there is a parking lot there and it is on the main floor, not like here where you have to find parking on the street and take an elevator up 8 floors. And then again, we're 5.5 staff members now. Yeah, and hopefully we'll have everybody cross-trained very, very soon. And just a little bit of a timeline to where we're going and where we've been. All of our books were written, handwritten or typed, and that started back in 1882. And that happened all the way up until 1955. So our vault was full of huge, heavy books. In 1955, we began microfilming all of our records, and that lasted until 2004, where we introduced software called DocuWare, and now everything is indexed and scanned. Every document that comes through our office is indexed and scanned. And now, as of Monday, our books are going to be restored, because during the indexing process that happened during COVID, a lot of our books got damaged, a little bit destroyed, but we are required to have them to last. We are required to keep those original records, regardless of how we keep our records. We still have to have the original record intact. So it was very important that we restored those books. And Monday, they did come and pick up 128 books. And so that process is now beginning the restoration process is beginning. Sorry, does anybody have questions up until now? Because I'm talking really fast. Ellen, I see you looking.
The books were damaged. Is it just because you're taking all these books that haven't really
Well, they're really heavy, and they're 150 years old almost. And so the materials used then are very delicate anyways. But when they went through the process of indexing, you have to flatten the book. So a lot of the binding was damaged. A lot of the papers were torn. They were already very brittle anyways. And so, and all of our microfilms was also actually indexed as well. So everything is indexed and images are available. But then we have to deal with human error, because these were done by people. And so reading those books can be hard sometimes. And so if a record is entered wrong, we still rely to go back on the books to actually visually see the new or see the old record. Oh,
And,
There's
and when
nothing-
they're bound, will they'll just be stored, but will they, they're gonna be kind of preserved in the best way they
so
possibly
some of
can
the
be, or-
books, there's
do you-
actually a schedule. Some of the books require that the pages be restored. Some of them were just the backings or the spines be done, but we're actually getting all of them are going to be recovered in a harder material so that they last longer. Literally, when this is done, because we do not use them as much as we used to, they won't be pulled off the shelf as much. They won't be brought out and put on a copier as much as they used to be. They should last for way more than 150 years, actually. They are stored in a fireproof vault, so they're gonna last us a long time. It was overdue, actually. So some of the services that we offer obviously are the issuing and maintenance of our birth and death records. We do charge a $15 fee for those records. We establish paternity in our office, by marriage and just regular paternity. What that means is in vital records language is just that a father is named on a birth certificate. Again, that can be done at the hospital within the first 72 hours of birth. It can be done in our office by appointment or ordered by a court order. Paternity by marriage is very similar, except for you are changing the status of the record from illegitimate to legitimate using a marriage certificate to do so. Again, these are services that we offer. They're not mandatory, and they are available up until the age of 19. We do charge a $75 fee for those services. It is done the same day, and a legal record, new record is issued that same day as well. We do correction affidavits and correction by notifications. They are very similar. The difference is if the child is under 2, it is a notification. And basically, we can change the record without affidavit. Most of those happen because there's a hospital error, miscommunication, language barriers, things like that. Another example of a correction would just be the misspelling. Michelle has 2 L's, but she's been using 1 L her entire life. Those are simple things that we can change. There are 3 things we can't change. That's somebody's last name, the year of birth, and their gender. Those require a court order to change, so we cannot touch those things in our office unless we have a court order, and we do get those as well. Again, this is all done by an appointment. It is a same-day service, and you walk out with a new legal record. The court orders that we do legal name changes, court order paternity, adoption records, gender changes, and other. When I say other, that is a broad field now, just because there are a lot of requirements that are changing through the country, our state, and other countries. Dual citizenship is one. For example, we have a lot of countries where abbreviations were done. A lot of the Polish names or Latin names, they are abbreviated. For example, Maria sometimes say MA. That is not acceptable if somebody is trying to get a dual citizenship somewhere and requires a court order for us to change that record. We're seeing a lot of that change coming through as we our community is growing here as well. Genealogy. Everybody loves genealogy in my office. Basically, that is a search fee. That is for records prior to 1955, and that's honestly a rule that was set a long time ago, and it was because we had to go to a book to find that record, and it was just a long, tedious task. And it kind of still is, especially if there's limited information available to look. The $7 search fee just covers the names and us looking for the record. If you do want a physical copy, it is $15 in addition to that. And then finally, we offer notary services. There are 3 notaries in our office currently because the services we provide do require that we are notaries to notarize the documents that people are signing. And so we offer it to the public as well, just for $1 a page.
Is that anything?
Yes.
You notarize anything?
Yes. But we are able to decline as well. Personally, my staff will only notarize templated documents. We will not accept a handwritten note from somebody, things of that nature, just because we can't verify or translate the words or things like that. So yeah, but it is $1 per page, very cheap, cheapest you'll find in the county, actually. And then updates. So In the original PowerPoint, I mentioned that we were close to securing the contract with the vendor for the rebinding. We did secure it. They have already been to our department again to pick up those records. They did that on Monday. 128 books went out. There's a little bit of, there was a miscommunication or a miscalculation on the math. So there's like a $1,200 difference of what actually needs to be done. So that's coming back through again to be re-signed, but it came in way under what we thought it would be. And that's a good thing. And again, all of the South Bend books that were housed here are being done. We do still have Mishawaka books in Mishawaka, but those books need less attention because they were not used as much as the books here in South Bend. The other big thing that we have coming is the paperless application process, which basically is getting rid of the paper that the people who come into our office have to fill out for an application. So we have purchased PCs that are going to be touchscreen, large monitors, and the entire process will be done via touchscreen. That will eliminate the entire paper process unless somebody requests to fill out the application on paper. Not only does it make it easier for us, but it's in the long run going to be less storage for us. Also, eventually it will pay for itself because that's less paper that we have to, that's the main thing that our department uses is paper for the birth, paper for the death, and paper for the applications. It also gives us an opportunity to highlight some of the other things offered in the health department. For example, during the time that the screen's not being used for the application, it can highlight the CHWs, environmental, any new facts that are coming through can pop up on the screen, things like that. The CHW surveys, which is something that we've implemented into our office now as well. So when somebody actually takes the survey that they offer, we can now help people that need financial assistance or display that need. By taking that survey, they can click vital records and it goes into a queue for us to decide whether or not it is valid, and we are able to help them with that now. But again, it's cross-referencing not just our unit, but also giving them insight into other units as well. So that I'm excited about just because.
So are you saying that you still have to be physically present on your specific computers, or can this be done from home and come in and pick up a
So we've
document or
been
mail? or-
offering the online ordering from home since COVID. Actually, the day the county shut down, we went live taking, and that was a coincidence. We went live taking internet orders. So we've been taking internet orders since 2019. And we get an abundance of them. We use the county's platform through Civic Plus, and then we also use Vital Check as a third-party vendor to offer overnight services through UPS. So somebody can request a record today and have it in California tomorrow. One big purchase that we did make, as well, is our microfilm machine was weighed about 250 pounds. We did purchase a new microfilm reader. The importance of that is for, again, our film was put into DocuWare, indexed and scanned. Our books were indexed and scanned, but a lot of those records, especially the film, back then they used two different types of I don't want to say ink, but sometimes it was hard to read. And if it was scanned incorrectly, maybe it was a little bit blurry. The new technology that's offered allows us to adjust the contrast, the image, all of it, so that we can get a clear, visible image. So for something that we may have to give somebody for free just because it wasn't legible, we can now charge for again, or something that I couldn't read, they couldn't read, whether it's somebody's maiden name, et cetera, we can now see what that cause of death says. So that was a big purchase that we needed. And it's really neat to see. But that's it for updates. Any questions?
The touch screens.
Yes,
That they're going to be in the office.
correct.
Where are they going to
counter.
go?
They're going to go on our counter.
Oh,
So right now, so it's a process. Our lines were just dropped last week. New data lines were dropped because we need data lines to supply all of those and electrical outlets as well. But we currently have glass on our counter. That was put up in 2020, I believe. That has to be moved back a little bit to support the new equipment. And then holes need to be drilled in the counter to bring the lines down through there. So there's a little bit of maintenance that needs to be done. before it can go into play and IT can actually get in there and start loading up all of the software.
And how many touchscreens will you have?
We bought 4. We have 4 areas that people are able to apply. And then eventually, once the Mishawaka construction gets done, hopefully we can get one over there as well. Just exciting because I haven't seen anybody in this building doing that yet, and so we will be the first.
Great.
Can you refresh my memory? It says to be prepared and efficient when House Bill 1457 begins.
Oh, that one's
generating-
coming up next. Yeah.
Oh, got it.
So
Okay.
that's the, yeah, that's goals and objectives. Obviously a goal is to have all of this done by the end of the year. I do believe that our, touchscreen paperless application process will probably be done, but the books, and the restoration will take months to do. That's going to be a long process and it's going to be done in phases. And then finally, House Bill 1457. So House Bill 1457, it's not a big deal to most, but for a vital records person, it is a big deal just because like everything we do, it has to be accurate, efficient, cross-referenced through and through again. This bill is essentially stating that anybody born in the state of Indiana can obtain a birth certificate from any county, regardless of their birthplace. That went effective July 1st of last year. One, we don't have access to records from other counties except through the state system, which is called Drive. The problem with that is our own records in Drive are inaccurate 90% of the time. The second problem with that is the communication between the local health departments and the state. Everything is done through a ticket and an electronic portal. So we have to put a question in a ticket that goes through a portal and hope they respond within a week. So if I have questions about something I can clearly see is not accurate, I can't issue the record, but this law is stating that I have to. So at that point, what do I tell the customer? When this law went through, the legislation and the legislators did not have vital records at the table. So nobody from the State Department of Health Vital Records Division was giving any information or suggestions or anything. So it just went through the way it went through. And as far as I know, nothing has happened to amend it yet. They were trying, a lot of things falling on deaf ears as it usually does. I personally do think that this will be great eventually, but the state is way behind the local health departments. The state trusts our records more than themselves. When the state went through and electronically stored all of their records in their databases, they hired a third party to do so, but they left a big chunk of the records out, which is the amendment section. So anybody that's had an amendment done to their record, if it wasn't brought to the attention of the state that it was not in there correctly, it's going to be wrong. If there's missing information, it's going to be wrong. That's the biggest problem. It would be great if it would work, but it doesn't work. So having the staff of 5 in South Bend is great when this does come for full circle and actually work out for everybody. I would love to give somebody from Elkhart their birth certificate so they don't have to drive all the way to Elkhart and vice versa. But just as it sits now, it's not a good thing. So that's all I have. Does anybody have questions?
So when is that supposed to go into effect?
It went into effect July
It
1st.
to effect.
But even after it went into effect on July 1st of last year, we didn't even have the ability to view records outside of our county. And then that happened. I found that out on accident, just going into places I shouldn't have been. And then I found out one day by accident, I noticed a feature was highlighted and I clicked it and I was able to print. And again, nobody told us, hey, do you guys know you can print now? And the reason why we weren't told is because they don't want us to. They're not encouraging it, but the literature reads may. It says may, and we all know that may means you can or you can't, but they're encouraging us not to do it. But I don't know how to respond to that. If someone says legally, you have to.
Has anybody asked? in the last
So
year?
yes, we have people come in daily and ask for their records and I say, I don't have an accurate record to issue you. That's what I tell them. So, and then we give them the address and telephone number for the location that they need to visit or who they need to reach out to. The good thing is most of the counties, you can obtain your record by applying online. So. Anything else? Okay, thank you.
Thank you, Erica. All right, next item on the agenda is new business. Item 2423, discussion and vote job description, perinatal education and program coordinator.
Now it's my turn.
Yes.
So you should have before you an updated job description for perinatal education and program coordinator. And this job description is an update to our previous perinatal, prenatal led education coordinator. And this is to expand the duties of that job description. So it's not specifically just for lead. But as we look to expand our maternal infant health initiatives, we will be creating education and different programmings that we will have available for the community. So this position will continue with her lead coordination, but in addition to that, we're expanding for the MIH initiatives in education.
So this job description obviously is different than the other one.
Right, so it is still the lead education, the lead coordinator duties, and then at the end, it highlights what additional duties she'll be responsible for the MIH program.
And so is there a place that tells you what the changes are, what the additions are?
So I can tell you in the.
Yeah. Thank you.
You're welcome. So under the duties on the second page, maintains complete and accurate records. And then the collaborates and maintains underneath that, those three paragraphs or sentences is what's describing her additional duties.
Any questions or comments?
I make a motion to approve item 2423.
Thank you. We have a motion. Do we have a second?
Second.
A motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
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 Opposed, same sign. Motion carries.
Thank you.
Thank you. Next item on the agenda 2424, discussion and vote, donation of items for school health.
Hi,
Hello.
I'm Ashley Hellman. I am the school health liaison, and I'm here to answer any questions you might have about this proposal.
Could you give us a quick overview of, how this came about and what we're responding to?
Yes, so as part of the school liaison role, which began full-time in March, we have been visiting schools face-to-face, meeting with administrators and health professionals and asking them what their greatest needs are in schools. Many of those things are things that we are able to support, but some of the things don't fall under our funding priorities at this time. However, they have been coming up time and again in schools. Things such as hygiene supplies, if somebody has an accident and needs a clean pair of pants, materials to help diabetic students if they are having a low blood sugar issue. At this time, many schools are having their health professionals buy these things out of pocket. Or the students have to wait in the nurse's office while the health professional contacts a parent. The parent takes time off of work, gets transportation to the school, brings the item. And sometimes students can be in the nurse's office for hours waiting for a parent to arrive. That's lost time for parents, but it's also lost instructional time for our students. We know that we have a lot of great civic-minded people in our community. We have some really great groups that are supportive of needs in the county. And I feel like they may just not know that these needs are present. And so we would like to be the connector from schools to civic organizations and philanthropic groups to help get these supplies to schools where they're needed.
So will you do outreach to various?
Yes,
Okay.
so we've identified, already identified multiple groups that have youth and education as part of their priorities, their funding priorities. And so if this is approved, we would reach out to those groups and give them more information and ask for their help to either purchase products, do a collection drive, or to help connect us to other groups in the area that may also be willing to help and support these.
Will you have criteria like everything has to be packaged and new and that kind of stuff? Is that part
Yes.
of the?
So we thought about different options, but really the things that we're asking for, it's in the best interest that they be new, packaged, that, you know, everything is coming in. We would have some guideline, you know, we'd be asking for specific items, but for instance, if somebody wanted to do a drive for pants, if they were donating new pants, we wouldn't say no, but we would say schools are really requesting elastic waist pants, things that are going to fit a multitude of sizes and body types. And so we would give guidance there as well, but mostly we would just be, you know, asking that they follow our donation areas and that the items be new.
Would you take money in lieu of items?
So we don't want to get into the area of accepting money. And so instead of doing that, we would like to have an Amazon wish list. And so if an organization says, you know, we really want to help, but we just have some money that we'd like to put towards it, they can go to our Amazon wish list, order those items. Those things will come directly to the county city building, and then we can distribute them to the schools.
So how, on the end of getting these things to the schools, how are you going to decide who gets the items, what the needs are on the school end, how you'll distribute the donations?
That's a great question. And first of all, we are going by what schools are asking for. So schools are telling us what they need, and every school is different. We are reaching out to schools across all districts, private schools, public schools. We are trying to work with every institution that is educating children between the ages of 3 and 17 in our county. Once we have met with schools and let them know that we have resources available, they let us know what they most need. And then we have a team that meets monthly that goes over the requests from schools. And so we're able to make sure that that each school is fairly considered, that we're not only giving to a certain school or certain area, that everybody has an opportunity to be a part of the program, to ask for resources, and that we can support multiple schools in the area.
So ultimately, all of the donated items will end up here.
Yes,
And then from here, they'll go out to all of the schools.
correct.
And I assume we have a place for all of these items to come and.
So we do have some space. The items that we are asking for are very highly requested. And so I don't foresee them being in a storage issue for a period of time. So of course, we're meeting monthly, and so there might be a little bit of time in between there, but otherwise I foresee that they will not be staying in the area for a long time.
I just thought of this, how somebody from the school pick them up? Are you going to deliver them? How is that going to work?
So at this point, whenever a school requests something that we are providing them, we typically deliver. If a corporation is requesting for multiple schools, sometimes they will send a nurse leader out to pick up the items. But the beautiful thing about being able to go into the schools and deliver is that's another relationship point to be able to, again, meet with the nurse or the school admin, let them know that you're there, and continue to build those relationships going forward.
And you said you've reached out to all the area schools already?
So we have over 100 schools in St. Joe County and counting because I continue to find more. And that includes things like homeschool co-ops, all different types of schools. And so I've spoken with face-to-face with health professionals from health professionals and staff for over 53 schools in the area at this point. And that was between March and the end of May when school ended. And so the goal is to have those meetings with every school going forward into the new school year.
Versus you're not sending out letters or anything like that to administration or?
So that is part of actually our fall program, is that every school will get a letter to their principal, and if they have a health professional on staff, to their health professional. Again, just introducing us, saying that we're a resource, that we'd like to meet with them. I make phone calls personally to school professionals, and it's not always easy to get them because they are busy, they are working, they are doing really hard stuff with kids in our schools. And so I want to make sure that everybody knows that this is available and be able to continue to grow our network and our ability to resource schools.
So how much is this actually costing the health department as far as staffing and running to the different school? Like,
So
obviously the donations are not
Mm.
on the budget, but what is this a cost to us?
So that would just be the cost of my position. The school liaison is a new position. The full-time position is a new position that was going to be funded under HFI going forward. Previously, we've been funded under the Crisis COAG grant, and the whole part of the school liaison role is that we are the connectors, we are the relationship builders. And so it does cost a salary to send me out and to have me connect people and, talk to organizations and all of those sorts of things. However, that is what the role.
That's not additional cost. There's
Exactly.
No additional.
No
cost.
additional costs.
And going out to the schools, it's not, you're not looking at it as solely you just delivering goods. You're going in and touch points with
Yes.
the staff and the health nurse, the school nurse and the
Yes.
administrators. Okay. So killing multiple birds with one stone.
Exactly.
So are you also the person then that, and I don't think I'm gonna say I don't know if it's called the Red Cap program, where they can request medical things, the different schools. Are you also the person that is reaching out to them for those?
Yes,
Okay.
I am. So that Red Cap program, they can request physical items, but they can also request health education. They can request connections to other programs. And so it's been a really great place for us to get needs very specifically and to know that we get a good rationale as to why those things are needed in the schools. And so those requests, that's where we get our requests from for our team to meet and go over.
Cause that is in our budget, the Red Cap stuff. Okay.
Any,
Oh, but I think I've already asked Dr. Migliore this, but this isn't to donate like medicines like Tylenol or anything. This is for regular prepackaged food and looks like hygiene, toiletry needs and
Yes,
clothing.
Yes. Oh. Yeah, we're no medications, nothing like that. Just the types of items that are listed in here.
So when we talked about the Red Cap program before, I didn't understand that it was for any school, private or otherwise. Is that true? Like the Red Cap, like meaning the money that we allocated from the health department for that program, like for AEDs and different things that the schools want that are not covered. Those are also open to private schools and any other.
Yes,
Okay.
yeah, yes, they are. And Red Cap itself is a survey program, and so we use it for a few different things, but are you talking?
Where they
about
can
the
request-
request form, yeah,
Yes,
yes, yes.
Okay.
Any other questions for Ashley or Dr. McLeary? on this? I assume legal counsel has looked at this and we're okay here? Nothing?
Dr. McGlory and I discussed.
Okay, great. Would anybody care to make a motion on this request?
I will move. I will move to it, to accept, recommend this, receiving donations to go to schools.
We have a motion. Do we have a second?
Second.
Any further discussion? All those in favor, please say aye.
Aye.
Hi.
Opposed, same sign. Motion carries. Next item on the agenda, grant requests. We have none this month. Old business, we have no old business. Moving into the public comment section. If you do want to speak, please sign up on the clipboard over on the table by the entrance. And so at our regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may only speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during open sessions of the Board of Health. The board president may interrupt, warn, or terminate a person's statement if the statement becomes personally directed, abusive, obscene, or inflammatory. So with that being said, Jenny, do we have anybody that would like to speak? No public comment. Okay,
Can I make a brief comment for public comment?
sure.
Okay, I just wanted to say, my family and I stopped by at the health department picnic about 2 or 3 weeks ago. And it was lovely. What a lovely idea. Everybody's having a lot of fun. The food was, I was not worried about food safety at all either. So, I was very glad to have had the chance to talk to some people there, and I hope it becomes an annual thing because it's very nice opportunity to just socialize.
Agreed, a very nice event. So thank you all that contributed. Okay, time and place of our next regular meeting, July 17th, 2024, 4:30 right here in the 4th floor chambers. With that, last item is adjourned.
Can I move to adjourn? I will move to adjourn.
Sure.
Do we have to move to adjourn?
Yep, meeting is adjourned.
Thank you.
You had that power.
I think so.
I think we discussed the fact
Yeah.
that you were. You had that exceptional authority.
Mhm.